When he was born, I sensed this, something wasn't right, even in the hospital. He was very jittery. I could tell it was more so than my daughters. And the doctor that examined him, he said something like, time will tell. Then he had a seizure at 2 months that felt like it lasted forever. And we took him to the hospital and everything pretty much came back normal. And then I kind of panicked because I was like, why doesn't anyone know what this baby has? He told us he was going to refer us to Dr. Darryl De Vivo, a doctor that he had studied under, and we were going to be in excellent hands.
I first met Joey when he was 7.5 months old in 1989, and he had started developing little jerks of his body, which basically were seizures. The thinking was that Joey probably had a mitochondrial disease, and this doesn't quite fit anything that we are familiar with other than low blood sugars. But there was no evidence that Joey was hypoglycemic. And I said, gee, this must be a defect in the transport of glucose from the blood into the brain.
He was the one that discovered the disease. He quickly started writing papers about it. So the easiest thing for other doctors to find out about this is through just PubMed, through manuscripts that were written by Dr. De Vivo. So really that's how the medical community found out about Glut1.
With Glut1, the first in-human studies were done here, and that's because of Darryl. He's relentless. No is not in his vocabulary. He's kind of soft-spoken, but he's really driven to help kids.
In 1991, Dr. De Vivo first described Glut1 deficiency without really knowing what the cause of the disease was. And then in 1998, the gene for this disease was identified. He developed animal models for the disease. He described the natural history of the disease. He was the first one to come up with the idea of gene replacement therapy for Glut1 deficiency syndrome. We've shown in the lab that it works quite well. And our next step is to translate that into a clinical treatment.
Our baby was having hundreds of seizures a day. I mean, his eyes would roll up. When we went to see Dr. De Vivo, he was so kind and just felt so comfortable with him. And then right away, he had a solution. They would introduce the ketogenic diet, something that we had never heard of 34 years ago. And after 3 days, he said his seizures would stop. And we went to the hospital. Everything went as Dr. De Vivo said, and after 3 days, the seizures stopped. We began our journey with like the best doctor ever. He's brilliant, he's amazing, he's so supportive. If we didn't have him, I don't know how we would have gotten through it.
We are so lucky to be able to know him and to have him guide us in this journey. We're very grateful for him. He's changed our lives. If it weren't for him, I don't know where my son would be today. And just really, really grateful for him.